I don't know anything about bowel cancer.
Something to do with your nether regions. That's about all I know.
Probably haven't got a clue because I'm probably too young.
Running the toilet quite a bit, regular than what you normally do. Loose bowels, bleeding.
Bowel cancer, not the most pleasant topic of conversation, but did you know it's Britain's second most common cause of cancer death after lung cancer? And yet, if caught early, more than 90% of patients could survive. This month is Bowel Cancer Awareness Month, so I'll be taking a look at some of the work being done to help people spot signs early. And I'll be speaking to a researcher whose pioneering approach to cancer treatment is improving survival rates. This is Irene Slater, who volunteers for a cancer awareness project in Stoke. She's passionate about discussing bowel cancer because over 50% of 60 to 70-year-olds don't take up free screening tests.
We get literally dozens and dozens of reasons why people aren't doing it. And basically they're all excuses. And they vary from, oh, I couldn't do that, although I might well pick up whatever my dog leaves on the village green, but I won't do that. And it's not fair on postmen, and you shouldn't be sending through the post because it's not healthy. None of which is a reason for not doing it, actually. You collect a little sample from your poo, faeces, whatever you like to call it, and put 2 little smears on there. Close it up, date it, and then put that back on the shelf in the bathroom for the next time you have to use it. That's all done, and within 10 days you can rest assured that you haven't got a problem if you're cleared.
At 55, Linda Smith was too young to qualify for the national screening test. She was fit, healthy, and looking forward to giving blood for the 50th time. 2 years on, she's living proof you don't need to have any symptoms to be diagnosed with the disease.
I first became aware that there was a problem when I went to give blood, only to be told that my haemoglobin levels were far too low, which was a bit of a shock because I do eat a healthy diet and I didn't feel ill in any way at all. That led on to having endoscopy and colonoscopy tests, and that's where the tumour was found in my bowel.
Thanks to early diagnosis, life's back to normal for Linda, but advances in drug development meant she was able to carry on even during treatment.
The treatment has progressed so much over the last few years, so much so that I was able to take my chemotherapy at my son's wedding, nice and quietly with a glass of water in the loo, and then pop back to all the activities, and I didn't miss a thing. It really, really frightens me to think that if I hadn't been a blood donor at the time, I maybe would have gone too far along for it to be successfully treated.
Thanks to research, survival rates for bowel cancer have doubled over the last 40 years, but it still kills around 43 people every day in Britain. I'm at Birmingham's Cancer Research UK Centre, where one team of researchers are hoping to improve survival rates by delaying surgery.
Up until now, surgery has been the mainstay of treatment and really the only curative option for the treatment of colon cancer. For the first time, we're now using chemotherapy to try and shrink down the tumour, reduce the tumour burden, and hopefully reduce the size of the operation that's required to remove the tumour. The first trial undertaken in this field is the Foxtrot trial, and that has completed and reported on its pilot study on 150 patients. But what that has shown is that we can safely deliver this chemotherapy in combination with surgery without seeing adverse effects on the patients in their recovery from their operation. Perhaps even more exciting is that we've seen the tumours shrinking and even some tumours disappearing altogether before the operation. And this makes it look as if we can cure a far higher percentage of patients than would have been curable if we'd done surgery first.
As one of the first patients to benefit from the trial, Alan Sugden is now enjoying quality time with his granddaughter, and he's been able to continue his hobbies playing golf and travelling abroad.
In 2008, I went to the doctors with hemorrhoids, and which I got treated for. I didn't want to disturb him because obviously going aboard that it kept on coming back. So I then finally went 12 months later, and he decided then to send me for tests for bowel cancer. I thought, oh dear, as my boss I used to work for had previously died of bowel cancer, I thought that sounds like I've got it as well. Then I had a phone call from the cancer nurse saying that my case had been discussed at their monthly cancer meeting, and that I would be an ideal candidate for cancer trials, for the bowel cancer trials. I felt that due to the people before me going through clinical trials, I would put myself forward for clinical trials.
Choosing whether or not to enter a trial can feel like a bit of a lottery for some patients, and many decide to stick with tried and tested methods of treatment. But despite his wife's early reservations, Alan's gamble paid off.
It's enabled me to see my first grandchild. Simple as that. Which I may not have been able to see if the treatment hadn't been available to do what they've done.
Alan was lucky. Although his cancer wasn't diagnosed until 12 months after his symptoms began, he survived. Many people aren't so fortunate. Although survival rates for colon cancer are improving, latest figures from Cancer Research UK show the number of cases have risen by 6% among women and 29% among men since the 1970s. That means that early diagnosis is still a crucial factor when it comes to successful treatment. So, don't die of embarrassment. If you have any symptoms of bowel cancer, get them checked out.